me state again that this is the most devastating event in the modern history of Puerto Rico. That it is an event where you have two Category 4, Category 5 hurricanes passing through an island and passing right down through essentially the middle of the island, impacting all of our main infrastructure and having essentially nowhere to escape. This is an event that has virtually destroyed our energy grid capabilities in Puerto Rico, and with that has limited our telecoms and access to other resources.
I'm Paul McKellips for FEMA Public Affairs in the interior of Puerto Rico. Hurricane Maria hit Puerto Rico only 1 mile per hour slower than a Cat 5. But wind was not the only problem. Maria dropped more than 20 inches of water in some places. Entire streets were wiped off the map, and the one-lane roads that still survived left asphalt hanging precariously over drop-offs that plunge hundreds of feet below. The rains keep falling, and the interior mountains of Puerto Rico keep claiming more homes and roads.
So over the past month, when Cutter Forward has been responding to these three hurricanes, Harvey, Irma, and Maria, what we have done is been able to deploy and support both cutter boats, patrol boats, and helicopters through both fueling, stores, and other logistics and command and control support. We've refueled our helicopter that has gone out and done critical port assessments in both the Keys area, search and rescue in the Keys, as well as port assessments.
I was one of the primary coxswains that was shuttling supplies back and forth into the sector right after the hurricane. I mean, we got here maybe not even 24 hours after the hurricane hit, so we were pretty much the first responders. And we stayed out there for about 6 hours just shuttling cases and cases of water. I want to say it was something like 400 cases. We had supplies, blankets, food, all kinds of stuff. The way that we got all of the supplies inshore, all of it was in the helo hangar. All the cases of water, all the supplies, everything. We had to daisy chain it from the flight deck to the fantail, and they would load everything into a cargo net. The crane would pick it up, hang it over the side of the ship, and we'd come alongside in the small boat, and we'd just station keep until they lowered it down. We'd rearrange all the water for the weight. We'd take 1 or 2 loads at a time, and then we would bring it in, offload it, come back, do it again.
We are with you today. We will be with you tomorrow. We will be with you every day until Puerto Rico rebuilds and recovers bigger and better than ever before.
The JISC is a Joint Incident Site Communications Capability System, otherwise known as a Communications Central Hub, or we call it a Terminal 6-9. The purpose of the JISC is to provide communications platforms ranging from satellite, data, and radio communications to a remote region where aid and relief is needed. The JISC in Puerto Rico is going to be deployed in a region where there are no communications, where there is no cell towers, there is no radio there is not much of anything, no internet at all. We are going to establish a communication center for the first responders and local agencies to communicate to hire.
My technician job here, so happened that the vehicle that the GIS is going to be loaded into was getting serviced. So when I found out what the vehicle and the generator were for, I said, well, I want to go. I'm from Puerto Rico, and they're going to need a mechanic. So I volunteered, and luckily for me, it got approved.
Today, the department continues to support FEMA and hurricane relief efforts in Puerto Rico. To date, the department has deployed more than 11,000 active duty and National Guard troops, dispatched 80 tilt and rotary wing aircraft, provided 5.8 million liters of water, 7.3 million meals, 22,000 cots, 11,000 tarps, 278 generators, and more than 100 fuel trucks and drivers.
The Puerto Rico State Guard is basically managing the regional staging areas. FEMA is distributing food and water through the island, and we are in charge of transferring that food and water to 10 regional staging areas known as RSA. We receive the food and the water, and then each regional staging area is in charge of holding that food and water so that municipalities, through their mayors, come and pick up whatever is assigned to them. State Guard is a volunteer force. We work on the Puerto Rico state laws, and our commander-in-chief is the governor of Puerto Rico. Our role is basically with the Army and the Air Force locally. There are two divisions. One is State Guard Air Force and State Guard Army. Our role specifically is helping the Puerto Rico Air National Guard in sustaining their bases locally. We provide personnel to help them with piloting, air operations, security. We train together, and we've been fully integrated into the operations that I just mentioned.
Getting trucks up here to deliver food, water, and diesel fuel is a major challenge. FEMA and their interagency partners deliver food and water by barge and air bridge to Puerto Rico. From FEMA distribution centers, the commodities are sent to regional staging areas where local municipalities send their trucks and police escorts every day to bring life-sustaining goods back to their survivors. The coastal areas of Puerto Rico are coming back to life faster than the interior towns in the mountains. Roads in the interior are narrow and winding. No one really knows what's waiting around the corner of the next switchback. Toa Alto is a county of nearly 75,000 people located north of Naranjito and south of Dorado. Food, water, and supplies are stored in the local clinic, where the mayor's staff then distributes them house to house. The interior of Puerto Rico is often described as being isolated. Well, that's because of the roads you'd normally expect to see in mountain communities. But isolated in Puerto Rico does not mean sparsely populated. There are homes everywhere. Houses are built on top of the mountains and into the hillsides. Hurricane Maria and the daily rains that seem to wash away yesterday's progress have not been kind to the people in the interior.
Hi, my name is Jaime Gambo. I'm with the U.S. Forest Service here with Southern California Incident Management Team 2. We're here at helping out with efforts for Hurricane Maria, which occurred here in Puerto Rico. The U.S. Forest Service is coming to provide ESF support in the interagency effort for FEMA to come and help out clear roads in order to get food, medical help to the citizens of Puerto Rico. What we're finding as we're coming out and evaluating the situation through other intel and validating with our own resources, a lot of work that we're intending to do and get roads passable has already been occurring with the public. So the citizens of Puerto Rico are doing an outstanding job coming out and clearing roads to help get the aid that's needed. And because that's occurring, we're bringing our folks in and just making the roads wider, more usable so that we can get more aid into the areas that need it. And we're doing this across the whole island. We are working with FEMA in order to make sure that these efforts are taken care of for the citizens.
Water in the interior is abundant. There are fresh springs everywhere. Resourceful residents even use PVC pipes to capture fresh mountain stream water into their cisterns, tanks, and buckets on the side of mountain roads. Municipal water still sits in water tanks and reservoirs. The challenge is getting the pumps to work on generators alone.
The U.S. Army Corps of Engineers has been on the ground installing generators at critical facilities to include 66 hospitals. 15 of those hospitals are now operational, and 51 are operating on generator power.
For FEMA Public Affairs, I'm Paul McKellips in Puerto Rico. The electrical power grid in Puerto Rico was already in bad shape. Hurricane Maria was the knockout punch. When 100% of the island lost power, all eyes focused on the hospitals where people were most vulnerable. Dr. Rafael Rodriguez Macardo is a neurosurgeon and the Minister of Health.
We have a total of 69 hospital facilities in the island. The rest of the hospitals are run by diesel and need water. So that represents a big challenge because we have to take diesel and water to those hospitals in order to maintain their operations.
Diesel fuel is loaded and rotated among hospitals daily.
What you see here is basically the DOD involvement with FEMA operation. They're doing refueling to get fuel for the hospital, the most critical infrastructure that we have to support.
Centro Medico is the largest hospital complex in Puerto Rico.
They are set of 20,000 jobs each, and we move the heart of the medical center from here with this diesel.
Jorge Mata is the executive director of the hospital.
The hospital has always been open. We got power and water from the Puerto Rico yesterday, but we have been running with tanks and generators since.
So this hospital did not close?
This hospital did not close. Centro Médico is a number of hospitals. It's just not one hospital.
Randy Crow is the team commander from Texas Fort DMAT out of Dallas-Fort Worth.
Central Medico Hospital is to provide hospital decompression, ER decompression. They got overrun with patients. They were stacking up in the hallways. The surgeries got behind, and we were asked to come in and help them relieve some of that.
Hurricane Maria damaged most of Puerto Rico's 69 hospitals. With progress through cooperation, now around 40 hospitals are back online and more become operational each day.
Well, we work very closely, not only with the military, also with the HSS. Between the military and HHS and the government of Puerto Rico, we plan the logistic of health care around the island in this type of emergency. So we work hand to hand in order to delineate what is the best medical care that the island needs according to the needs of the region that we are evaluating. There are regions that they already have power, that they have water, so we don't have to take too much concern about that area, but that is only 10% of the population have electrical power. So we are focusing in the areas where are no communication, no power, and highly populated areas where the medical service is not the appropriate.
A federal medical station has just opened in Manatee, Puerto Rico after Hurricane Maria. Kevin McGillicuddy is the team commander from Florida 5 DMAT.
What we have set up here is a 150-bed federal medical station, FMS, and that is a shelter care and people with long-term chronic health needs that need a place to go if they can't stay at home or if they've been discharged from the hospital. The other part of it is on the other side is we have an acute care facility for anybody in the community or any of the patients here that have any acute medical needs. We can manage them here, stabilize them and send them home, or if they need be, we can transfer them over to the hospital to get definitive medical care.
The National Disaster Medical System brings medical professionals from all over the United States. Sharon Diggs is the deputy.
So behind the curtains, it's an acute care setting. We have patients with could be chest pain, can be respiratory issues as far as asthma, who their vital signs were a little concerning to put with the minor care. So we went ahead and we've set up, it's a 8-bed area, and they're better monitored with equipment and so forth.
And who can come here?
Anybody, any resident of Puerto Rico who's in need of quick medical attention can come here. Truly, from newborns to 110 years old.
And they don't need an insurance card or payment?
They don't need anything. All we need them to do is give us their name and what their complaint is.
The very best in medical care are here to help their fellow Americans.
My name is Michael Charnas. I'm Chief of Staff at VA Boston Healthcare System. I came here to be Chief of Staff of the VA side in this integrated function. And our mission is to do whatever we can to help the people of Puerto Rico meet their healthcare needs.
My name is Lisa No. I'm the Associate Director for Geriatrics and Mental Health in North Chicago, Captain James A. Lovell Hospital. I'm actually in the role of the nurse exec here, so I'm responsible for all of our VA nurses that are here 24/7, and again to support our mission here for Puerto Rico.
On Tuesday, the USNS Comfort arrived with 800 medical personnel providing patients with a full suite of care, including surgical, pediatric, and trauma support with 250 hospital beds.
We have a mission to go deliver a capability and get involved in an operation to reduce human suffering in an area that has been devastated by weather over the last 5 to 6 weeks. That's all I'm focused on, and that's all that my medical professionals that I'm going with are focused on.
Good morning. I'm Captain Kevin Buckley. I'm an emergency medicine physician with a subspecialty in pediatric emergency medicine. I am the commanding officer of the hospital, or called the MTF, Military Treatment Facility, on the comfort. We have the capabilities of any hospital that you have in this country. So we have full bunch of specialists. I have a CAT scanner, angio suite, and I have dialysis capabilities. The only thing we don't have on board is an MRI, because if you know MRIs, they don't do very well with metal, and you can see there's a lot of metal there that would probably interfere with that. So we don't have an MRI, but we do have a new capable CT scanner, ultrasound. We can run up to 11 ORs, but we're only going to be loaded for 6. The ship is built, the primary mission is for combat support. So the combat support mission is a little different package than humanitarian. In combat, we don't bring OBGYN doctors and pediatricians and neonatologists. In this tailored package, we have more community health, more primary care. I have a 50-bed ER capability on board the ship. I have the ability to store about 250 people, and we'll have up to 50 ICU beds. The potential of the hospital ship, actually, if it's made for combat, would probably be one of the largest trauma centers in the United States. If you Google it, it'll be number 7, because it has up to 1,000-bed capability. We're not packed on 1,000-bed because, again, our mission is not trauma for combat. It's more for humanitarian assistance.
Initial reports and disasters are often wrong. We knew Ryder Hospital was severely damaged and their ER and ICU were running on one backup generator, but then word spread that 50 critical patients needed to be evacuated. Randy Smith, team commander of the Alabama 3 DMAT, explains.
It overheated, it hit about almost 300 degrees and immediately shut down on its own. So in discussing, we were talking with, like I said, the hospital administration. We started formulating plans to evacuate everyone from the hospital. We had 32 patients. We had 5 critical patients that we needed to air evac to the Comfort. We were able to evacuate via military aircraft. We had 2 Blackhawks that came in and landed. We passed off 1 ventilator patient and 1 critical ICU patient to the first Blackhawk crew that flew to the Comfort. The second Blackhawk crew took the last 2 ICU patients. The doctor decided that the 5th patient could go by ground. During that, there was some communications, difficulties between our location operating off of sat phones. That the word was that we had 50 patients to evacuate immediately. So we had at one point 7 Blackhawks, 1 Navy helicopter, a Sea Stallion, I believe it was, and then 1 air medical unit from local. Along with about a half a dozen or so private ambulances from the island itself, from Puerto Rico, from this area of Puerto Rico.
My name is Robert Torres. I'm a K-9 for Special Operations Group. My K-9 is a search and rescue K-9 and also is a HRD. We are here for until we complete the mission to support Hurricane Maria, and willing to help any agency that needs us to support this mission that's going on until we don't know how long it's going to take. In the search and rescue capacity, we'll be working with the dog, any outstanding person that one other agency is going to need out there. We'll be able to help out in that aspect and try to find what we're looking for. Could be a single person, a group of persons, or whatever the need is for the mission. My partner Pepper, he's a Belgian Malinois. We've been together for 5 years. He's 7 years old, and he's been doing the job for 5 years. 5 SAR and 3 for HRD.
The Oaxaca Dam in northeast Puerto Rico, the Corps of Engineers is doing erosion repairs. This work is critical to more than 230,000 people who rely on the reservoir above the dam for drinking water.
Citizen soldiers from the Sapper Unit of the 1013th Engineer Company of the 130th Engineer Battalion are working hard at Isabela, Puerto Rico. They are working alongside members of the Puerto Rico Fire Department to clear the water channels at Siphon 21. Hurricane Maria caused landslides that blocked these channels that provide water to 7 municipalities on the western side of the island. By clearing this path, they will also help release the water pressure on the Oaxaca Dam, which is in danger of collapsing. Reporting for the Puerto Rico National Guard's Public Affairs Office, I'm Army Sergeant Marimar Rivera Medina.
5,000-pound jersey barriers with a MP-22 Osprey in order to put them into the washout area of the dam, so that way we can prevent more dirt and debris from washing out of there from the running water.